Hello, my name is Andrew Burgee, and I'm the Hazardous Materials Training Coordinator for the NYU School of Global Public Health Hazardous Waste Worker Training Grant for our grantor, NIEHS. Welcome to our COVID-19 Exposure Recognition Module overview. This module focuses on the origin and definition of COVID-19, its symptoms, transmission pathways, impact on human health, and the methodologies of controlling exposure and minimizing illness. The virus that causes COVID-19 and its similarity to and variants from other contagious agents, specifically the viruses that cause influenza and the common cold, will also be explored. The goal of the Lesson 1 is to prevent potential exposure to COVID-19 by understanding the biology of the virus and differentiating its symptoms from other illnesses, like influenza, when a person is affected. SARS-CoV-2 is the virus that causes coronavirus disease 2019, otherwise known as COVID-19. Though coronaviruses are a large family of viruses that are common in people and in many different types of species of animals, this coronavirus is a novel virus that has its origins in bats. According to the Center for Disease Control, or CDC, people with COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Please note that these symptoms are not exhaustive. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. This list will be continually updated by the CDC as they learn more about COVID-19. As expected, multiple variants of SARS-CoV-2 have been documented in the United States and globally throughout this pandemic. Please consult the CDC website for more detailed information. COVID-19 and influenza or flu are both contagious respiratory illnesses. SARS-CoV-2 is the virus that causes corona disease 2019, which is COVID-19. Influenza is caused by infection with the virus of influenza. Both COVID-19 and flu have varying degrees of signs and symptoms, ranging from no symptoms or asymptomatic to severe symptoms. People who have the flu often feel some or all of these COVID-like symptoms: fever or feeling feverish and chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue or tiredness. Some people may have vomiting and diarrhea, though this is more common in children than adults. It is important to note that not everyone with the flu will have a fever. New loss of taste or smell is not a symptom of the flu. People with these symptoms may have COVID-19. Fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle and body aches, headache, especially new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. This list does not include all possible symptoms. The CDC will continue to update this list as we learn more about COVID-19. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on skin tone. This is not a list of all possible symptoms. Please call your medical provider for any other symptoms that may be severe or are concerning to you. Call 911 or call ahead of time to your emergency medical facility and notify the operator that you are seeking care for someone who has or may have COVID-19. According to the CDC, when comparing a common cold, also called rhinitis, versus the flu, Among the symptoms here are some rare and uncommon symptoms of a common cold that are common or unusual in the flu: fever, headache, and chills. Because colds and flus share many symptoms, it can be difficult or even impossible to tell the difference between them based on symptoms alone. Special tests that usually must be done within the first few days of illness can tell if a person has the flu. If a person has COVID-19, it could take them longer to develop symptoms than if they had the flu. Typically with the flu, a person develops symptoms anywhere from 1 to 4 days after infection. Typically with COVID-19, a person develops symptoms 5 days after being infected, but symptoms can appear as early as 2 days after infection or as late as 14 days after infection, and the time range can vary. Most people with flu are contagious for about 1 day before they show symptoms. Older children and adults with the flu appear to be most contagious during the initial 3 to 4 days of their illness, but they may remain contagious for about 7 days. Infants and people with weakened immune systems can be contagious with flu for even longer. With COVID, it is possible for people to spread the virus for about 2 days before experiencing signs or symptoms and remain contagious for at least 10 days after signs or symptoms first appeared, even if the symptoms were never displayed or went away. Both COVID-19 and the flu can spread from person to person, especially between people who are in close contact with one another, usually within about 6 feet. Both may be spread to others by people before they begin showing symptoms, by people with very mild symptoms, and by people who never develop symptoms or are asymptomatic. Both are spread mainly by droplets generated when ill people cough, sneeze, or talk. These droplets can infect when inhaled or in contact with the mucous membranes of the nose or mouth of nearby people. It may be possible that a person could get infected by physical human contact, for example when shaking someone's contaminated hands, and then touching their own mouth, nose, or possibly their eyes. While COVID-19 and the flu viruses are thought to spread in similar ways, COVID-19 is more contagious among certain populations and age groups than the flu. Also, COVID-19 has been observed to be involved in more super-spreading events than the flu. That means that the virus that causes COVID-19 can quickly and easily spread to a lot of people and result in continuous spreading among people as time progresses. Both COVID-19 and the flu can result in severe illness and complications. Those at highest risk include older adults, people with certain underlying medical conditions, and pregnant people. Regarding differences, the risk of complications for healthy children is higher for flu compared to COVID-19. However, infants and children with underlying medical conditions are at increased risk for both flu and COVID-19. Both COVID-19 and the flu result in complications, including pneumonia, acute respiratory distress syndrome, which involves fluid in the lungs, cardiac injury, which involves heart attacks and stroke, multiple organ failure, which involves respiratory failure, kidney failure, and shock, worsening of chronic medical conditions, which involves the lungs, heart, or nervous system, or diabetes. This list is not exhaustive. Regarding the flu, most people who get the flu will recover in a few days to less than 2 weeks, but some people will develop complications, like pneumonia. Regarding differences, additional complications associated with COVID-19 can include blood clots in the veins, arteries, and lungs, heart, legs, or brain, or multisystem inflammatory syndrome in children. People at high risk of complications or who have been hospitalized for COVID-19 or flu should receive supportive medical care to help relieve symptoms and complications. Vaccines for COVID-19 and the flu must be approved or authorized for emergency use by the FDA. Regarding the flu, there are multiple FDA-licensed influenza vaccines that are produced annually to protect against the 3 or 4 flu viruses that scientists anticipate will circulate each year. Regarding COVID-19, 3 COVID-19 vaccines have been approved for use by the FDA under the emergency authorization use. Other vaccines to prevent COVID-19 are still under development. In conclusion, the SARS-CoV-2 is the virus that causes the coronavirus disease 2019 or COVID-19. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have COVID-19. Cough, shortness of breath or difficulty breathing, fever or chills, muscles or body aches, vomiting or diarrhea, or new loss of taste or smell. This list does not include all possible symptoms. The CDC will continue to update this list and as we learn more about the virus. Some emergency warning signs for COVID-19 are as follows. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on the skin tone. This is a mini quiz. Please answer the following 5 questions. Influenza and COVID-19 are both contagious respiratory illnesses caused by SARS-CoV-2. True or false? A key symptom that can differentiate between COVID and flu is shortness of breath or difficulty breathing, new loss of taste or smell, or a headache. COVID-19 symptoms usually occur 2 to 14 days, 15 to 30 days. There is no pattern. Which takes longer to present symptoms? Flu or COVID-19? Testing is required to differentiate between rhinitis and flu. True or false? Which complications seem specific to COVID-19? Pneumonia or blood clots? That concludes this first module. Be safe and thank you for your time.